Dear chairs, thank you so much for the invitation to the committee. It's a great honor for me to speak in front of Bulgarian colleagues, PRM colleagues. It's a great honor and congratulations for the Congress. I come from Vergata University, is in Rome, Italy. You see the structure of my university, and I want to speak about vibration. Vibration probably is full of doubt. And so we can begin to say that this is vibration. For example, the chord of a guitar are vibrating to create a sound. These are publications on vibration and rehabilitation. You see number of papers are 1,320 from 1963 to today, and is increasing the interest on vibration in rehabilitation. In general, the countries that publish more in vibration are United States, Germany, Italy, Canada, Japan, United Kingdom, and so on. So what vibration? Mechanical vibration is defined as the measurement of periodic process of oscillation with respect to an equilibrium point. So the oscillation may be periodic, such as the motion of a guitar string, or random, such as the movement of a tire on a gravel road. So all mechanical systems in vibration can be modeled by containing three basic components: the spring, damper, and mass. So we have three constants that are determined by displacement, velocity, and acceleration. We have many kinds of types of vibrations: sinusoidal, shock, multisinusoidal, transient, but in research and in practical use, we use harmonic sinusoidal waveform because permits to study scientifically the phenomena. So we have many frequencies of vibration, but in general we use low and medium frequency because we'll see in the next slides vibration can be dangerous. So when we speak about vibration, we have to speak about the natural frequency that all the bodies can have about frequency. And you see this picture, this movie, in which this bridge collapses because it goes in resonance with the wind. So vibration could be a great problem for the people too, if we use without caution. But I remember one great man that was close to here, that Nikola Tesla, that told that if you want to find the secrets of the universe, think in terms of energy, frequency, and vibration. It was in the beginning of the 19th century. So, definition of vibration is frequency, amplitude, and acceleration, and time of exposition, that is very crucial, time of exposition, represent the positive or negative crucial points induced on the body, human body. Because scientific studies confirm that a short exposition at a frequency between 20 and 50 Hertz and a displacement of around 2-4 millimeters doesn't cause negative organic effects, but positive physiological adaptation. So you see in this movie, one of the physiotherapists that are leading the treatment for an osteoporotic woman, and it's important to highlight that is really important to choose the time of exposition, the correct time of exposition, because vibration could be really dangerous. This is a study of Inoka from Karolinska Institute in 1994, and he showed us that the vibration can enhance the strength of the muscle, in this case is biceps brachii, in submaximal isometric, in maximal isometric, and isoinertial. In another paper issued from Russia and Israel, published in 1994, this publication about the possibility to increase the flexibility in pain threshold, the flexibility in the patient, because increase the pain threshold, there is more flow and temperature, and we have a relaxation of the stretched muscle. So vibration can increase the flexibility. About the maximal force, my group, Bosco, from my university, published this paper about the possibility to have a training by vibration that was equal, 10 days of vibration was equal to 12 months of traditional training in strength. It was obviously a paradox, but was a very, very important study in Biology of Sport in 1998 was published. So the vibration can enhance the force velocity, can enhance the curve force power. And another study from the Flieger group in Athens show us that vibration prevented rat early post-ovariectomy bone loss. We conduct a study in Vergata about the effects of whole body vibration in osteoporosis. Was a pilot study, and you see that the experimental group in only 3 months, vibrating 3 times a week, showed an increasing T-score value, statistically significant. Another aspect that I want to highlight in the vibe is the hormones, because in this paper of Carmelo Bosco, the acute exposure of whole body vibration causes increased plasma concentration of testosterone and growth hormone, and a decreased plasma concentration of cortisol. So vibration determine changes in hormones profile. And we can use in elderly people too, because the effect of vibration cause additional improvement on not only in sedentary subjects, but also in trained subjects. For example, we evaluate the possibility to promote bone healing using stimulation by vibration energy with local vibration modality. This was a prototype that we use in Tor Vergata for a local vibration. The methods are 30 treatments, 5 days per week, 6 weeks, 35 hertz frequency, and so on. And we try to treat non-union and in this manner. I'll show you the results easily. You see, this was a non-union after 6 months from the fracture, and on the left we see the admission, and on the right, on your right, the discharge after 2 months of treatment. Another X-ray shows the admission on the left and the discharge on the right. You see the callosio in the area. So the conclusion is that the effects of vibration energy on the bones tissue are an undisputable fact. Vibration in association with other re-educational treatment may be considered a first-line therapy choice in non-union delayed union fraction. So, speak about the procedures by vibration. You see in this case two physiotherapies that works, and for example, in enhancing the vastus medialis and rectus femoralis on your left, and a therapeutic exercise by vibration in the upper arm, right upper arm, by local vibration. So, is a physical agent or is a therapeutic exercise? So, exactly, I don't know how to say you. I know that it works because you have three environments. We have three environments where to do exercise, therapeutic exercise. Is hypergravity, is normogravity, and microgravity. The normogravity is the common modality of exercise in the gym, for example. And we have free or resistance motion in normal gravity field. We use the physiological patterns, and it's good for increasing strength and coordination. But we have the microgravity too possibility. We can do proprioception in microgravity, for example, too. And we have that means in the swimming pool, and we can have a reduced pressure on joints and soft tissues, increased proprioception control, and reduced pain perception. But we can have another possibility that we didn't have until 2006, in which in the Congress of Professor Lyons, I presented this slide, that therapeutic exercise in hypergravity is a development of procedures and application techniques which enable the development of contraction finalized to motor recovery during the application of mechanical vibration. So this kind of vibration can increase the development of force, increase proprioceptive afference, increased load in the joints and soft tissues. Obviously, we have a higher gravity field during vibration. We can reach 3 or 4 G during vibration. This is a case in which we treat a patient after a fracture, humerus fracture. You see my physiotherapist is working in vibrating the triceps, and she's gaining the ROM of the shoulder in this manner. And as physical therapy, you saw, obviously, the application of physical agents on body surface in order to improve patients' quality of life. This is physical therapy. And the application procedures of vibration are 3. Whole body vibration, upper arm vibration, and local vibration. Whole body vibration is in general a systemic vibration from down to up, and is a good procedure, for example, for osteoporosis and other problems. We'll see. Remember, it's better not to use machines that create the oscillation on the right, because it can create problems to the spine. You have to prefer the oscillation, the horizontal oscillation. We can have the upper arm vibration. You see this kind of, for example, to enhance the strength of the upper arm and to ameliorate the coordination and proprioception of upper arm. And we can use local vibration to treat directly to the skin, to treat problems, local problems that we can have in our patients. These are the three modalities. And this is another important point that I want to highlight, that we can use local vibration to reduce the spasticity. You see this movie in which I treat the triceps by vibration, and the patient that is a spastic, has a spastic upper limb, he can solve the block of the elbow, and for a few minutes. But I ask all of you, if I can do this by vibration, is better than using, in this case, the exercise therapy of the physiotherapist against the spasticity. I treat in this manner, I treat the spasticity of the upper limb. So, clinical application. Clinical application has muscle strength after PNS lesions or osteomyarticular lesions. Another application is in the reflex sympathetic dystrophy, complex regional pain syndrome. Another application in our area is proprioception recovery after orthopedic surgery. And other application is for reducing muscle hypertrophy after surgical treatment. Non-union fractures, I show you in the paper before. Osteoporosis or osteopenia. Obviously, I say you that you have to have cautious in the treatment. You have to control the patient and to decide the best vibration and time for vibration. A local pain, we can use vibration to reduce the local pain, and in this case we use the mechanic acoustic vibration, not only mechanic vibrations. Muscle flexibility and postural defects by muscle shortening in sports. Vibration is most used for the elongation of the closed kinetic chain of the lower limb. And now, this is a gift to my friend, the amplification of proprioception. Thank you, Marta. It's an honor to have your picture in my slides. Amplification of proprioceptive afference and balance deficit. So the indication could be osteoporosis, post-surgical hypertrophy, postural muscle retraction, ex non usu muscle weakness, spasticity, pain, RSDS, and balance deficit. But this is the most important slide, the contraindications that are high myopia, pregnancy, severe balance deficit, neoplastic disease in general, consisting blood and liquid collected, for example, a marrow or other effusion in the knee or hip or something, nephrolithiasis and hepatolithiasis, because vibration can cause a pain, acute pain in this case, and pacemakers. Okay, I finished my presentation showing this slide. This Mediterranean Forum of PRM is a nice, in my opinion, nice forum about physical and rehabilitation medicine around the Mediterranean basin, and the it's useful to create and to develop rehabilitation in the Mediterranean countries. But Bulgaria is a Mediterranean country because you have the Black Sea, and so is Mediterranean too. And I want to show you 2 points about this society, this forum. The Euro-Mediterranean Rehabilitation Summer School every year, that is for PRM residents. If here are PRM residents, can write me to participate to this course in Syracuse, Italy, and we can cover the expenses of staying there. And another point is the congresses that we organized, the 7th Congress in Kos, in Greece, in 2027, October, and the 18th Congress in Bulgaria, Burgas. It's an honor for me to say all of you this organization that it will be in 2029 in September. Thank you so much for your attention.